Okay, hello everyone. Welcome to IMU Medically Speaking. I'm the president, Wasfi. I'm from SEM 3, and this is my vice president.
Hi guys, I'm Mega and I'm also from SEM 3. And on today's podcast, we have two amazing guests today here with us. So one of them, Ishani, is my orientation senior and she's from the University of Edinburgh from UK. And we also have Nirhheshan, who's from Australia and he's in University of Western Sydney right now. So I think you guys, would you like to introduce yourself, starting off with Ishani?
Okay, hello everyone. So, like Mega said, I'm Ishani. I'm currently a fourth year at University of Edinburgh. It's nice to meet you all, and thank you for inviting me.
Hi guys, my name is Nirhheshan. I'm a fourth year med student at Western Sydney University, and it's a joy to be on this podcast.
Thank you guys for being here. So let's kick this off. I'll ask the first question. Can I know why you guys decided to choose the uni over the other PMS options? And was it your first option? Maybe we can start, Ishani, with your answer first.
Okay, yeah. So Edinburgh was my first option, and I guess the reason why I chose it was like really different factors. For me, it was a lot of like family influence as well. Like when I was choosing my PMS school, I was very confused and I didn't know really which way to go, whether it's Australia or the UK. And I think my parents definitely helped me a lot with that. My mom was very much in love with Edinburgh, and I think because of her, it also like pushed me, and I was like, okay, curious enough to apply, and yeah, that's how it got me here.
What about you, Nirhheshan?
For me, it was a lot of family influence as well. So my brother lives in Sydney, so he has his own family here. That was a big influence in terms of I'm very close with him, so it's easier access as well to just get to see him on the weekends if I need be. And it was just like a solid sort of start in terms of having a solid foundation to just to get used to Australia as well. So it definitely played a big part.
Okay. And did either of you guys ever been to these countries beforehand, or is it your first time there? Nirhheshan, you've been there before? Oh, sorry, Ishani, go on.
No, I've never been to the UK actually. I've been to Australia, but not the UK.
Okay. What about you, Nirhheshan?
Yeah, I've come here like 3 or 4 times because, as I mentioned earlier, my brother lives here, so he did his uni in UNSW. So I used to come here pretty often to see him. So in that way, I sort of got to know Sydney a bit, and I actually fell in love with the country as well whenever I came by and just explored. So that also played a major part in me choosing Australia and particularly Sydney as like my favorite destination to come for PMS.
Okay, so can you guys tell us more about how are you finding your experience in the respective universities right now? Is there any expectation versus reality that's happening, or is everything as what you expected it to be? Maybe Nirhheshan, you want to go first for this question?
Yeah, sure. So on my end, I didn't really have many expectations per se. I just walked in with a blank state, so to speak, just wanting to experience something new. Maybe I did expect a bit of a change, but clinical years is very different from pre-clinicals. That was a sort of a shock to me in a way because you have to actually interact with the patients. It doesn't matter just knowing theory. You have to be sort of on your toes socially as well just to get to interact with people. And you have to be gelling with the team that you're working with in the hospital. So that was a bit of a change. And in terms of culture and just sort of the atmosphere, it was pretty different to Malaysia. So it got a bit of getting used to, but eventually I did get used to it. And I think it does help having a good support system or like having friends, especially the ones you make in Malaysia. If you stay in touch with a sort of group of people, it does help you settle in. I think, yeah, those are a bit of a challenge at the start.
What about you, Ishani? Anything similar to what he experienced, or do you have any differences in your experience?
I think same. I came with like a very open mind. It was like very much a new adventure, and I was really excited for it. So for me, like anything new was like a good thing, not necessarily a bad thing. I think I do agree with like the clinical aspects of thing. It is really different being in like clinical school versus like pre-clinicals. There's like a lot more application, a lot more like active recall that you need to do, and just like getting used to like having patient interactions or doing procedures was definitely like quite scary to me at the start, but like eventually it got much better, I can say. Yeah.
So were there any factors you guys considered before choosing your universities of choice? like maybe the teaching style of the university or the lifestyle of not just the university, but maybe the country you went to, or even whether the university was prestigious and gave more opportunities, anything like that?
I think for me was definitely one of the things was lifestyle because as I've mentioned before, I've come by to Australia and it's a very sort of laid back, independent lifestyle. And it's a very sort of, I would say empowering in a way because your hours are fixed. If you go more than your hours, you get paid appropriately. It's very well regulated and balanced.
Mm.
And also it gives opportunity within different states. So you can go to a different state in terms of opportunity and see how the state is. If you like the state, they might have better pay, better teaching, or there might not be certain things you like in a different state, so you can move. So in terms of being able to do that, I definitely did consider that when it came to applying to Australia.
I think for me, again, it was like very much a joint decision with family as well. I think we thought that UK was like quite central. So in a sense that if I wanted to go like to Europe, for example, just to in terms of like work or anything, it would be like convenient as well. And then like seeing the countries that were recognized by my university. So if I graduated here, where would I be able to work? I think that was a big factor as well. So not necessarily like me going back to Malaysia, but seeing where my like medical degree would be recognized. I think that was another thing. And then just like lifestyle as well. And yeah.
Okay, so I think all of us are very interested to know how the academic experience is in UK and Australia. So as we know in Malaysia, for the preclinical years, we have classes like PBL, MMS, CSD, and things like that. So how does it differ in your respective universities? Ishani, would you like to go first?
Okay, yeah. So I'll just like kind of break down how the syllabus works for us. So they've changed it quite a bit. So each year it's like changing, but how it works for my year is that each month we go into a different block. So it's a 4-week attachment, and then you go through like cardiology, neurology, orthopedics, and then you rotate every 4 weeks till you come till the end of the year. So throughout the 4 weeks, they usually split you into different compartments. So example, 1 week you're just on the wards, and then 1 week you're just in all the clinics. 1 week you could be doing all the procedures, and then 1 week is like a mix of everything. You could be on call. So you go through different weeks so that you can see different sides of the department, and like eventually to the end you get like a whole view of it. In terms of classes, I would say not much. Maybe you get a bedside teaching or a teaching class once a week, but that's about it. So it could be a half day teaching, it could be just a bedside teaching, maybe an hour, but that's the most that you get. So it's usually you being in placement and kind of shadowing the doctors, the nurses, and like seeing how things run there.
I think in terms of Australia, like Ishani mentioned, it's quite similar, but it's different in a way where you're given more independence. So we have in year three a system where we have a 5-week rotation, and in the rotation we aren't split into blocks necessarily. We are dedicated to a department, and in that department we have to follow a team, and it's wherever the team goes, you go with the team. Whether you're with the JMO, if the JMO asks you to go with the registrar, so it just depends on if the consultant wants you to shadow him for the day. So it genuinely depends on what the team wants you to do. So in that way, it is quite different. It's a lot of independent. You have to go and find your own learning sort of. And then we don't have much teaching as well. We have a conference week in the middle of the year where they run us through sort of a few lectures, so like an oversight of what we can expect over the next few months. And we might have a few teachings. So I think last year we had a teaching on sort of empathy because we were told that they've been finding a lot of clinical students not having that sort of in the hospital. So that was one of the stations they focused on. So we do get teaching that's specific in terms of helping out at the hospital or being a bit more aware and helping us clinically. But other than that, nothing too much, to be honest with you.
So do you find like this makes it the workload more manageable or less manageable? So if you have to do a lot of like, if they don't have a lot of teaching, mostly you're shadowing the doctors and whatnot, right? And then I'm guessing that means you have to go and find your own time to study, right? And are you allowed to take time off the rotations to go and study, or do you just have to figure it out as you go along? And does this make them, do you find that this makes it easier for you because you get to structure your own study time and when you want to take the lectures, or do you think it makes it harder?
In my opinion, in my case, I found it a little harder because for us, we have an expectation to sort of show face to the team or at least be there a certain amount. Because at the end of each rotation, we need to get a consultant to sign off on our rotation assessment. So we need to be sure that we're competent during the rotation as well. So we need to allocate sort of placement times and our own time and studying time as well. And study time is a lot of independent learning. So lecture material, as most med students can attest to, is not that great. So it's a lot of self learning. You've got to go and find your own resources. You've got to obviously collaborate with other med students, and everyone is sort of running on their own schedules, which is a bit difficult to collaborate with other people in that regard as well. So it's definitely a challenge at the start. But I feel like once you sort of settle into a rhythm throughout the year, it's easier to sort of find time for yourself to study. But I feel like it'll always be a challenge with every rotation.
I think for me, I agree as well. I think one of the biggest differences or like difficulties I faced coming here was adapting to the difference in teaching style and like the whole going for placement studying balance. I think initially it was quite difficult, but like Nir said, like I think slowly towards the end I managed to find a rhythm to do it. I think for us it's a bit more flexible. So say that you were placed for wards 9 to 5, you could go for wards 9 to let's say 12 to 3, and then you say like, oh, okay, I've got to do some studying. Or they usually say like, okay, if you have some studying that you need to do, you go off. And sometimes if you're there for a half day only, then you have the rest of the day to study. So I would say it's like at the start of the block you have to, now I've learned that at the start of the block you have to see like where there are empty spaces, and also like set your own like list of learning outcomes of what you want to do. Because I think for me, IMU is very much structured. Like every day you go to class, you know what you're learning. There's a structure and a fixed list for you to do. But then for here, like when you come here, you have to form your own list and form like your own sort of syllabus and see what you want to learn. But I think, and that is like quite difficult. But for me personally, I feel like you do learn so much more on placement. So it's not to say that when you're on placement, there's no studying done. There is still, because if you have like good doctors, good nurses, they do lots of teaching as well. And that's more easily applicable. Like it sticks to you much easier, especially if you have like a patient in front of you who like you can link the diseases or the management to, and that's like so much more valuable than just reading from books. So yeah.
I think those are amazing points. Like it really differs a lot from what we do in IMU as well. But I think it's a great exposure both in the UK and Australia. So my next question is, how are the exams over there? So how is the pacing like? And what is the difficulty level like? And how do you even prepare for the exams there?
Okay, I think I'll go first. So for us, how they do it again, they're changing it every year. So every year is different. If whoever's watching, listening, if you come, it might be different for your year. But for us, so we're divided into two halves of the year. So at the end of the first half of the year, you do an OSCE, and then at the end of the second half, you do a OSCE and a knowledge test. So the knowledge test is 100 questions, so 2 papers. To get 200 questions, like split 2 days.
Each paper is 100 questions? Sorry.
Yeah. Each paper is 100 questions, 2 hours long, 2.5, 2.5 hours. Yeah. But essentially, they're trying to prepare you. Like I think each university in the UK will be different as well. But I think the end goal of the exam is kind of preparing you for the UKMLA, which is the final exam that you sit before you become a doctor in the UK. So all the exams, even though they are long, they are kind of preparing you for that level of like standard. So in terms of preparing for the exams, I wouldn't say I'm the best. I'm still trying to figure it out as well. But I think starting early and being consistent with it, I think is the most important thing. So if you're done with the block, you should be able to like cover fully so that your work doesn't procrastinate as you go on. And I think lots of students here use Past Medicine and Anki as well. So I think these 2 tools are quite helpful in preparing for exam. And like in terms of OSCE, I feel like just being on placement and like practicing your physicals and your histories a lot is good, and getting your like supervisor and consultant to kind of check you as you go along.
I think in terms of Western Sydney, it's a bit different. So like Ishani said, we have OSCEs as well at the half year mark in year three. And the OSCEs go on for it's just a day, and we have 6 stations. And I think in the 6 stations, it's broken down into 2 procedural stations, 2 history stations, and we have 2 imaging stations. So you'll be asked to do an X-ray or like a CT, and then you'll be asked to interpret the results or like break down bad news or something like that along those lines. And then at the end of the year, you get your SAQ and MCQ, which I found the hardest because in Western Sydney, there's no real like syllabus or guidance per se. We have we have a lot of people have different sort of varieties of rotations. So we are instructed that we should know what other people are doing in their rotations and sort of combine the information, which is pretty hard, in my opinion, because we've like 12, 13 different specialties that we're assigned to. So it all just comes into a matter of gathering as much information as you can. And just in my case, I found doing Ankies and using resources that the seniors give as pretty helpful. Because the seniors in Western Sydney are particularly helpful in the way they've got a compilation of previous year papers and previous year Ankies as well that help them. So just practicing that and sort of getting a feel of the questions sort of goes a long way.
What about during the rotations itself? Is there any kind of like assessment done while you're on rounds? Maybe like, the attendings will start asking you questions based on the cases you guys are doing. And are you guys also given any grades for this? Like, does it help contribute towards your overall grade at the end?
So in year three, we have at the end of each rotation, we have like a assessment by it's called a CAA, a clinical attachment assessment. So we have to get that signed off by a consultant who will go through a few sort of categories that they sort of reference us by. And a lot of the feedback goes from the team as well because the consultant's not always around. So it depends on how you interact with the patient, the wards in general, how you are with the team, and that as well. And we also have mini CXs, which I'm pretty sure Ishani has as well. So it's like mini assessments where you either take a history or you do a physical exam with the patient and then you go and report to one of the doctors. So we have to have 10 of those signed and be satisfactory for us to go onwards with the next rotation. And currently in year four, it's a bit of in Western Sydney, the year four is a bit different from year three and year five, where we're in only 4 rotations for the year. So each rotation has its own requirements in year four. So currently I'm in ONG, and in obstetrics and gynecology, how it works is we have 2 case presentations we have to do. We have to do our our MCQ and our OSCE as well to pass the whole rotation, and we have to get a few other things signed off, like a few in hospital things, like we have to observe certain procedures, we have to see C-sections, a lot of things that we need to get signed off on a logbook. So definitely the intensity does ramp up, but it can be sort of sorted out with just good time management and getting used to it, I would say.
For me, it's not that not as hectic. So, like Nir mentioned, we do have mini caxes. So they're basically like physicals or histories that you do, and then you go and present it to the doctor, and then you get the sign off. So when you're presenting, they usually will just ask you some questions about the case you present, and then, but it's never really an assessment way. It's more of like a casual or like a teaching style format in that sense. So it's more about the teaching and the learning. So for us, you get about 2 to 4 mini caxes that you need to do per month, and then you also have to write a reflective summary of your day each, like daily. So every time you go in for placement, you write a reflective summary that goes into your like logbook, and then sometimes you have a case-based discussion that you have to write. But that's the main kind of assessments or things that we have each block. And before you move on, your supervisor just like signs you off, and then that's you to move on for the next block. But over the year, there are like clinical skills that we need to like get signed off on as well. So for example, you have to do like 4 cannulas, 4 venipunctures, 2 cannulas, 2 oxygens, like 1A to E examination, for example. So like, this is done like throughout your whole clinical year, and it's like the minimum that you need to do. But obviously, you can go like above and beyond and do more. as well. So that's mainly it for us. But again, in the UK, I think it varies like university to university. I know friends in Manchester who have, I think, about 10 mini caxes that they need to do, and then they have like maybe like 2 or 3 presentations, and so it varies very much uni to uni. Yeah.
Okay, so after you guys were exposed to all of this, is there anything you wish that IMU students would have been told before they transferred? Any kind of like guidance on how to deal with these things, or just any other information at all that you guys think would have been useful before you guys transferred? Maybe you can start this one, Ishani.
I think for me, just generally in terms of like yourself, I think having good discipline is good, because it can be very easy to like come home after a whole day of placement and be like, I don't want to study, and then you don't study for the next month or so. So it can be very easy to fall into that loop. So I think like in terms of yourself, have good like discipline, have good consistency, and be like flexible with your timing. I think those are like very important things to have in terms of just like soft skills. In terms of like career wise, I think coming here, lots of people are very proactive outside school. So they do lots of like research, lots of like programs and events that they are involved in. And it does carry a lot of weight when you're thinking of applying for specialty training here. So if you're coming from IMU, I suppose like in first year, second year, it's not a rush, but do try to expose yourself to like different specialties or like research opportunities, so that you get a bit of a heads up or an idea of how things work. So that if you do come here, it's not too much of a culture shock, because when you come here, you do tend to realize that, oh, in third or fourth year, everyone has like at least like 1 or 2 research papers under their names, and you might feel a bit left behind. So I think like just keeping that in the back of your head, like knowing that you have to do that since your first year will be a good head start. But like don't be so stressed out about it as well lah. Yeah.
I think Ishani's pretty much covered everything I had to say. It's pretty much the same that I have to say. It's just everyone is sort of on top of what they're supposed to do. And for people coming in from IMU, it might be a bit of a shock, because we all have a guideline of what we need to do throughout the year, and we sort of everyone knows kind of what to do because of the guideline, and like there's a syllabus. We all sort of know what to do. But then when you come here, no one is telling you what to do. It's all on you. And I think the independence is something that IMU doesn't like. It doesn't get talked about enough. The sort of self-facilitated learnings. You have to go and find research opportunities yourself. You have to go and find conferences and everything else. You have to do everything yourself. And that's something I feel is not talked about enough when we move for our partner medical schools, whether it be in the UK or Australia. So I think that's definitely my biggest takeaway and the biggest piece of advice I'd give.
Yeah, I think I really agree with this, because I think we weren't really exposed to much research opportunities or what we are supposed to do. So this whole idea of transferring to PMS and then suddenly being exposed to a lot of other opportunities out there can be a bit daunting. But thank you for sharing your perspectives on this. I think it will be really helpful for all the students now.
Especially because we've barely been told that we need
Yeah,
these research
it is,
opportunities or going to conferences, or even how we would go about finding these opportunities.
Yeah.
Not something they really tell us.
Yeah.
I think as well, like in Malaysia, I don't know as much, but I feel like maybe I didn't look as much as well, but just being in IMU, I don't think it was emphasized enough, or like I don't know if research was a big thing in Malaysia as well. I could be very, very wrong, but I think here research is definitely more important. So like even in first, second, and third year, all the like students have like research classes, like things like that, and then they have to do dissertations. And for Edinburgh, you take your third year off to go and do research for a year as well. So there's a lot of it in syllabus, but yeah.
Wait, so if you take a whole year off to go and do research, does that research you do also, for example, you said some people already have like 2 research papers under their names, right? So if they've taken that year off to do research, is that still enough, or do you think someone should go out and like look for more opportunities outside of the one they do in their third year?
So how Edinburgh's program run is it's a 6-year medical program. So most of the students who like study start first year here. Third year, it's an automatic intercalation year where they go and do research somewhere else. So I would say it is a good thing to have, but the thing about it is as well, loads of other unis also have at least a block, if not a year of research work. So everyone as well would at least have maybe one paper on them. So I think like definitely if you're motivated, like go and find opportunities to do more papers or just like be involved. Like lots of consultants need medical students to help with like data collection or things like that. So I think like if you could help out in that way, it's like great as well. So I think definitely push yourself to try and do more things. Yeah. Don't stop at one. Like keep going. Yeah.
And just to add on to what Ishani said, I think unis here, like unis abroad as well, they definitely encourage and they'll help you more than you expect as well. Because in Western Sydney, in our fourth year, which is, and in my next rotation, we have a specific block for our MD project. So we get 9 weeks off, and it's just dedicated to us sort of doing our project. And that'll give you sort of a baseline if you are interested in pursuing it in year five. And then from then onwards, when you're a doctor, it'll sort of give you a basis and a guideline of who to approach, how does it work, how do you get approval, how do you publish. So they give you a very sort of, they do help you along the way. It's not like you're completely lost. As long as you be proactive and you approach someone for help, people here are more than willing to just help you out with your project.
Okay. All right, guys. So now I want to talk a little bit about the clinical exposure. Could you tell us like what it's like dealing with actual patients, and maybe give us a feel of how diverse the what's it called, the cases that you guys get are?
Okay, I think I'll start. Um, okay, I think dealing with patients is actually not as scary as you would make it seem to be. I know lots of people, including myself, were definitely very scared to go and like go approach patients, take a history, or just like examine them. But they're actually really, really nice. Like lots of them have like loads of stories to tell you, and like when you start talking to them, they're actually very, very, very approachable. So I think like getting over the initial like stigma or like mental block to going and approaching someone is, I think, the most important thing, because when you end up going and talking to them, they're more than willing to help you out. And yeah, I think what was the diversity of the patients? Okay, I would say very, very diverse. In Yeah, so you get lots of different kinds of patients. Lots of patients who don't really necessarily speak very good English as well. So in the wards, I've seen like countless times where we had to bring in like translators, or maybe some of the staff knew other languages, and that got to help. But I mean, they got to help along as well. I think because UK is quite central, like near like Europe and everything. So we have lots of like Spanish patients that come in, lots of like Polish people as well, and then just generally everyone from everywhere. So having a translator on hand was a very good experience that I got to see, and how you would communicate to a patient via like a translator or on your phone using an app as well. Yeah. Oh. Okay, yeah, I think yes. Okay, so I understand this question a bit better now. I think the most impressive thing for me, I think, on placement was being in cardiology, because I actually got to hear all the murmurs. So I think, yeah, like it's something you only see. I mean, when like in class, you only like read about it, but when you're actually on the block, you actually get to like auscultate the heart and actually listen and hear the murmurs and try to identify them. And then if you follow the patients into surgery, then you get to see how they change the valves, like implants. And yeah, and I was also in neurosurgery, so we got to see like I got to see aneurysm clippings, which I thought was very impressive as well. So yes, lots of diversity in all the cases. It might not necessarily be acute cases sometimes, because when you see them on the ward, they might already be there for a couple of days and they are on their way to recovery. But I think definitely lots of cool things that you see that you don't expect to see. Yeah.
Yeah, just agreeing with what Ishani said as well. You'd get to see a vast variety of patients, and in especially on a personal level, because I also did cardiology, and I found it much easier to actually remember and understand the murmurs compared to preclinicals, because all of us, when we practice our OSCEs on each other, we're perfectly healthy, And most of us get our OSCE practice, at least I did, from Geeky Medics or like YouTube videos that just show us how it's supposed to sound. But then when we actually go and see a patient, we see the signs, and then we, like as a doctor talking us through what we're supposed to hear, it's actually much easier to just retain that information and sort of apply it when you go around the ward and you see other patients on your own time. And you get a huge variety as well. So I also had oncology last year in year three, and that was a big change when I was at palliative care, because a lot of the patients there they are not expected to survive, and it was a very different atmosphere. That one that I've never seen before. The How I would describe it is the ward was very sort of, it was a dark atmosphere, and there was a lot of people who, like a lot of patients and their families who are just not in a good emotional state, obviously. And it was very difficult seeing people just struggling. And in a hospital, obviously, there's people struggling as well. But then there are normal people who are able to talk and they can still have a conversation with you. But in palcare, it's a bit harder to approach people. And you have to sort of tap into your empathy a bit more just to sort of understand what it's like to be in their position, because it really is difficult to see people in those kind of conditions. So I definitely see there's a big variety when it comes to clinicals.
So when you go for something like when you were in palliative care, do you also find it like more difficult to even know how to approach the patients?
It genuinely is. And then this is when your communication with the staff and the team comes into play. So you sort of talk to the nurses, because I think this is another very underappreciated tip. But usually the nurses can be better friends to you than the actual doctors are, because they interact with the patients more. So they know them on a more personal level. So when you go and ask them for help, you can just be like, is there a patient I can take a history from? Is there anyone I can talk to? Because there are some patients which I found very surprising, who are actually upbeat, in the sense they've sort of like come to terms with what's happening with them, and they're more than happy to share their experience if it means helping somebody else out, and they want to make the best of what they have left. So those are the people who you best can approach and sort of get a clear understanding of the whole picture from, in terms of, which is mainly cancer. So you get to sort of see their journey through cancer and what helped, what didn't, their family support, and all the things a normal med student or anyone in general would be curious about. But then when it comes to doctors as well, they'll tell you who to not approach, who can be a bit more moody. Like there's some people on mood stabilizers that they would ask you to avoid in order to not, disturb them. So yeah, it definitely is. It helps talking to staff as well, and they will definitely help you out.
I think there's like a lot of variety of experiences. So as far as we know in IMU, we only meet simulated patients, and we only get the real patient exposure from our postings in SEM 3 onwards. So I think there's a lot more to expect in the clinical years itself. So I think that brings me to my next question, which is about student life itself. So can you tell me more about how a typical day looks like for you? I think we have covered how on-call rotations work for you, but more about how you structure your day and how does it go for you each day?
I mean, for me especially, this year it's been a bit different because I have different rotations. So I had pediatrics early, which was a lighter schedule. So in terms of that, I'd finish up around 1 or 2 at the hospital. Then I'd go to the gym for a few hours, like 2 hours ish, sort of clear my head, just go to the gym, just stay fit. Then maybe I'll come back, I'll do a little bit of studying with friends, or maybe have dinner with friends. Or just if I need time to myself, maybe just stay at home, do a little bit of studying, clean the room, do laundry, cooking. I think there's a lot in terms of, again, living independently, which a lot of students would know, where you have to do your own laundry, cooking, etc. That does take up a surprising big part of the day. Yeah, so I would definitely say that's generally how a day would go. Just you and then you can find your time for socializing and going out to the city, but in Sydney it's pretty big. Sydney is a very big city, so I found it pretty tough to find time apart from the weekends to go out to the city, because it takes an hour to go from where I stay, which is Campbelltown, where the university is located, to go to the city. It's 1 hour by public transport. So it's definitely something that is a bit difficult, but as I mentioned earlier, everyone finds their own way,
Yeah.
and it's definitely possible to just have a good life here.
Okay.
So for me, I think day to day, when I end is very variable. So sometimes if I'm on morning clinics, I'll end around 12. If I'm on wards, then I start at 9. I end depending on day to day and what's going on in the wards on that day. But usually it'll be go to placement, schedule a gym session either before placement, so in the morning or after placement. And then after I come back, I usually, like Nir said, do chores, eat, and then I also work part time. So my evenings are usually fixed for work. So I work from like 5:30 to 11 ish on weekends. So that's that. If I'm not working, then it's usually maybe dinner with friends or just studying. But yeah.
Does working affect your studying in any way?
I would say no at the moment. I scheduled it in a sense depending on my placement. So I was quite very busy last year and I was still adjusting to moving to the UK. So I didn't work most part of last year. But I started working in February because the placements I had coming up were a bit more flexible, like just hearing from friends as well. The schedules were a bit more flexible and definitely doing it. I don't do it full time, just part time. So maybe 2 or 3 times a week where where during those times I do need a break as well. So it's not necessarily disrupting my studies. It's an opportunity for me to kind of get away and like clear my head. So I use my work as a time for that as well. So I won't say it's a distraction. It's more of a like a relief
Yeah.
time.
I think, Ishani, it's very surprising how you're taking a part-time job in medical school. I think that's really unexpected. But can you tell us more about this job itself? Is it something that came through a uni or something you're doing externally just for...
Yeah, I would say over here especially, it's not uncommon to see people working. Lots of medical students do work here, whether it be in like healthcare. So I have friends who are like phlebotomists or carers sometimes, and lots of friends that do work in healthcare as well, like social work. Yes, lots of friends who do that, or they help out in like care homes, nursing homes. So lots of medical things that you could do, and then there are like the unmedical, like non-medical side of it. So I work in a restaurant just as like a waitress and a front of house staff. So it's just mainly like taking orders, serving food, that kind of thing. But yeah, lots of different types of jobs that you can find. If you're looking for something more flexible, I know friends that do tutoring as well. So that's very like remote. You can like schedule it according to your own timing. Friends who do babysitting as well. So I would say not very uncommon for students here to work, especially medical students. And if you plan your time like wisely and you schedule it well, it actually fits into your schedule quite well.
Nirhheshan, what about in Australia? Is there a big community of students who like also take up part-time jobs, or do you think it's more difficult there?
I think it's very encouraged here, in fact, and a lot of people do take up jobs. Me personally, I was just worried last year when I was settling into clinical years. I didn't want to take up a part-time job because I didn't want because, like Ishani mentioned, I was settling in and I didn't want it to interfere with my clinical years. So for now, I'm not planning on taking one, but a lot of my friends do. And like Ishani said, it's a huge variety. Some people take healthcare inclined part-time jobs, and a lot of people do non-healthcare jobs like like in the kitchen or like doing waitress or waiter kind of jobs. It really is a big variety, and a lot of people in med school surprisingly do part-time jobs as well. But a lot of people do it over the weekend, so in a way it doesn't conflict with their schedules, and they can sort of manage their lives better.
Yeah. So, other than that, how would you say it's like your social lives? Did you find it easy to make friends when you guys moved, or would you say like it's been more difficult abroad than here? Maybe Nirhheshan, you can start.
Yeah, so for me, I did find it quite difficult at the start, especially because I don't think a lot of people talk about it, but when you move from IMU to a different country or different university, it's hard to just let go of your old friends. You still have a big sort of connection and you've made a community there and you have a lot of friends, a lot of people, and a lot of memories tied up in Malaysia. So it does get time to sort of get over that. And another thing is you move into clinical years, you're moving during your clinical years, so everybody is already sort of busy trying to figure out how their days go about with the clinical years involved. So not a lot of people have time at the start. You meet a lot of people through rotations, of course, but then after the rotation ends, there's nothing keeping you guys sort of communicating or talking. So more often than not, the friendship just fizzles out afterwards. So I would say at the start it is challenging, but you eventually do find your own community. You just have to show up for events and try and get yourself as exposed to as many events as possible, and you will eventually find your own set of people. You do. It's not an impossible feat. Everyone will find somebody, but it's just harder, I would say, when you go from already having an established circle to starting all over again. Because especially in my case, I actually came to IMU from Sri Lanka, so I had to start over once, and then I came to IMU and did in the first 2 years. And I again settled. You obviously settle into a rhythm when you move countries and when you meet new people, and then having to break that rhythm and moving to another country again. So in that way, the changing of an environment is challenging, but you definitely can sort of like adjust to the different environment and find your own group of people.
I think for me, I was very blessed that when I came to Edinburgh, there was a very big I came with lots of friends from IMU, and we have a very big IMU community here in a sense that every year there's about 13 to 14
Oh,
students who
wow.
transfer together.
Yeah.
So it is a big group. And when we first came, the seniors were very welcoming. We had like picnics and just like gathering sessions. And I also live with two seniors. So I feel like, and other IMU friends as well. So I think having that community did really help me to feel like it's a home away from home for me. In terms of meeting people in the med school itself, I think it was a bit better in my case as well because when I transferred over, there were also students transferring from other universities. So there were students transferring from St. Andrews, which were about like 30 students or so. So in a sense, we weren't the only ones new. There were other people who were new as well. And that kind of helped us mingle with them and like meet. Like since we were both new, we kind of clicked a bit better. Yeah. But I think like Nirhheshan said, sometimes on placement it's a bit tough to make new friends, especially if you're the only person on the ward for a week. You don't really see much of anyone else unless you're paired up. So that can be a bit difficult sometimes, like matching everyone's schedule. But eventually you do end up either trauma bonding or just being very reliable, like being like a team with the person on placement with you, which is how I met one of my very good friends here. And eventually you do find your friends. It's just that how far you're willing to go to make that connection. Like if you're going to schedule, I don't know, like meetups, or if you're going to like just go an extra mile to try and make new friends. So I think it does require a lot of effort and energy from your side, but I think if you persist, it definitely pays off.
Yeah, I think one thing
Just
people.
add on to what
Sorry, no, please go ahead,
to
Nirhheshan.
what Ishani said.
No, it's okay, you go ahead.
One of my closest friends I found was I was waiting with groceries by a bus stop, and he offered to pick me up. I didn't even know him at the time. So just be prepared for any kind of encounter because I found it very suspicious at the start, but I agreed to it because I was a new student. And then a year later, he's one of my closest friends. So it's not all doom and gloom. Anything can happen, and just be prepared for it. Just go with the flow, and it'll be all right.
I was just saying, I think also something people forget, like when they're in a new place, they forget that other people are also trying to make friends, right? So it's much easier than you would think if you would just put your hand out first, you know?
Yeah, definitely. I think just trying to go to events, it's very like draining, especially when you first move. Everything's really new. It can be like very emotionally and physically draining, like starting up the same conversation of people, trying to think of like common topics which are not as common as you would think. Like because I think growing up here, our culture is really like in Malaysia, our culture is really different as well. The topics that we talk about are very different as well. So coming here, you have to try to like figure that whole thing out as well. So yeah, but eventually it does work out. You just have to put in a bit of hard work, and then
I think we covered a lot about the student life and how it is to find friends in UK and Australia as well. So I think the next question many people are curious about is how is the cost of living over there? Because it's really different from Malaysia itself. And can you also talk us through how are y'all staying in a dorm currently? Is it provided by the university, or how is it funding yourself over there?
If I go first, so how I would talk about cost of living is, I mean, I'm pretty sure some people might have seen it on the news, but Sydney's not exactly the best. With cost of living, it's quite expensive living here, and it is getting a little worse year after year. And especially with the recent uh, global political issues or whatever you may call it, there's been an increase in fuel price that also does play a part. But you can manage it. It just depends on how it's a lot of you do. At least me in Malaysia in IMU, I did a lot of takeout, a lot of like grab. And when you move abroad to like in Australia for me, I did a lot. I now do a lot of cooking. So it's just sustaining yourself, preparing ahead with groceries. You have to sort of give up, sacrifice in terms of eating out and stuff like that. But you definitely can manage. It's just about having a budget and actually sticking to it because it's definitely more important here in terms of sticking to a budget.
Is there anything you've become an expert at cooking now?
I can make a mean chicken stir fry.
Oh, damn, let's get it.
I can definitely last you for like a week, and it's pretty easy to make.
Yeah.
I'm pretty good at it, so it does help out a lot. But yeah, cooking is something you automatically get good at if you keep doing it day after day.
I'll be coming for that recipe soon. What about you, Ishani?
I think the thing that takes up most of your expenses is definitely rent, and rent can vary from city to city. So for me, I'm staying in it's not the university dorm, but they have like private student accommodations here as well. So like student accommodations by a private provider, not necessarily by the university. So I'm staying in one of those now, and it can be a bit more expensive than like regular flats. But I think for us, because of the convenience sake, and our heater is on, it's unlimited, so it's 24 hours that it goes on. There's no cap against it. So I think that worked very, very well for us as well. So we decided to stay again this year. But I would say it really depends on your own priorities, if how much you want to allocate for things. I think like Nir said, having a budget. So I have a fixed spreadsheet and I put in every expense that I have and try to work out where my money goes. So I think having a good like consciousness on like where your money goes is very important. In terms of cooking, yeah, that's the biggest thing that can help you save, because eating out is not very cheap. So not cheap. So a meal that you could get outside is probably like a week of groceries sometimes, or half a week of groceries. So it does definitely add up if you take away or if you eat out. So cooking is your definitely biggest way to save money. For me, I was on like I heard of like many different apps that help you save money as well. So there was one called, oh no, I don't know what it's called now, but there was one app where people give away their stuff that they're not really like using anymore, and I got a free blender from them, which is like still in good condition and working quite well. So that's one of the things that I did. And then there's lots of things that can help you like save money here and there. So there's platforms like Vinted and Depop, which can help you sell your stuff and you can get some money back as well. So things like that. And then there's platforms like Too Good To Go, which give away like discounted food from restaurants, and my friends get Krispy Kreme from them for a very good discounted price. So like doing little things like that, I feel does help you save, but also being like a bit conscious about where your money's going, and like budgeting will definitely help you save. Yeah.
I think I can vouch for Ishani's cooking, because like she always posts on her Instagram different meals, and it's always so exciting like how she can like prepare a 3-course meal which looks so good, with all the other activities she does.
I mean, if one meal costs the same, like if one meal outside costs the same as 1 week of groceries, I'd turn myself into a 5-star chef too.
No, exactly. It's like if you, I don't know, the thing I miss the most here is like hot pot or like
Oh,
K-barbecue.
yeah.
And it's like maybe 20 pound to eat outside, but you could get 20 pounds worth of food for like, and split it amongst like, I don't know, 3 or 4 people. So you have to be, and like that works out to what, £5 per person. So it really depends like how resourceful you are, or like, yeah, with cooking as well, there's lots of like with Instagram and everything, there's lots of like easy student friendly recipes that you can meal prep for the week, and it'll definitely like help you a lot. Yeah.
So is there any expense that surprised you guys the most? Like one thing that made you go, whoa, I cannot believe that's that expensive here.
I'm going to straight up say eating out is the biggest surprise for me. Because like Ishani mentioned, one meal out is like 1 week of groceries. And now whenever I go out to eat, my first thought is, oh, that's like one box of chicken worth. Like I can buy one box of chicken when I go groceries instead of getting that one meal. So that was definitely a big eye opener for me. And another thing was rent, to be honest. Like I didn't mention in my previous response in terms of my living conditions, but I stay like Ishani similarly to like a private corporation that's loosely affiliated with Western Sydney, like EOS for all the IMU people. So I stay in a 5 bedroom apartment, and cooking is a bit tough with 4 other people, so you don't have the kitchen for too long because everyone wants to cook. And rent was definitely eye opening, especially in Sydney because I have a few friends in Melbourne and Brisbane who said rent would be around $150 in a 5 bedroom apartment typically, but in Sydney it's $100 more. So it was pretty eye opening for me when I first came here. But yeah, that and I would say honestly groceries.
I think we can all appreciate when our parents said there's food at home now.
Yeah.
For sure.
I think for me, I think because I'm in Edinburgh and I do have friends in Dundee, some in Manchester and Glasgow. So sometimes when we come around and talk about the different prices, it definitely shocks me how much rent here costs. So I think I pay about 190 per week for my room, but I have friends who pay 150 for a room double my size per week, or like even less than that. So or like I think 100, yeah, something like that, but definitely significantly lesser and for a bigger space. So I think rent definitely is one thing that's expensive, and when you're applying for PMS, I think it's things that you should take into account as well, the city that you go to. For me, it's transport, surprisingly, because just in Scotland, if you're under 22 years old, your bus passes are free. So I do have friends who are like 21, 22, and have been using free bus passes. But for me, I have to pay a monthly bus pass or a yearly pass, which in hindsight might not be too much, but it does go up quite a bit. So when my senior was first year, it was about £50 per month, but now it's gone up to £68 per month in about 2 years. So it's risen significantly high, and I just wonder how is it going to be like going forward. But yeah, I think that's one thing that's my biggest like lump sum expenditure per month, and it hurts a bit sometimes. But yeah.
Might invest in some roller skates if I ever go to Edinburgh.
Honestly, if you bike, it's really good. I do have friends who bike to placement, like bicycle to placement to hospitals. If you can do it, I would respect it, and like you definitely could save more. It's just that Edinburgh's very hilly and it gets cold during the winter as well. But yeah, definitely a sustainable and cheap option.
Now I have to teach Mega how to ride a bike.
Yeah, but I think definitely the cost of living is something I'm not looking forward to because I think in Malaysia, all of us order Grab. It's just something so exciting. We just pick food every single day to try out. So I'm definitely not looking forward to that, but we'll get there. So the next question for me is the lifestyle and culture in UK and Australia. So is there any culture shocks that you had when you first went to UK, Australia? Something that's different from whatever we practice over here?
Like I mentioned before, I think for me the biggest thing was the level of independence here. So everyone sort of values their like personal space, freedom, independence, which I don't think we get much in Asian cultures where people, I wouldn't say nosy, but people just want to know more about you and they want to maintain a connection and get to know you on a more personal level. But here, everyone has a lot going on in their lives. Like I mentioned, people doing rotation, part time, and having a relationship and having their own lives as well. Like a lot of people have a lot of things going on. So often they might not have time for other people that you would usually expect coming into the country, where you expect people to be social. So that was definitely a big eye opener for me in terms of how people are more independent and sort of they want them they're sort of working on themselves too, and everyone's trying to figure their own way out. So that was a bit of a culture shock. But then after a while you sort of get used to it. Again, like I mentioned, everything just needs getting bit of getting used to. And when you're also doing clinical years and when you also get burnt out as well, you appreciate the space sometimes. and you will eventually find people who think the same way and click the same way. It's just a matter of like exposure, getting used to the country, absorbing the shock, and sort of moving on in a way from like life in Malaysia and just accepting the transition to a new life in Australia, in my case at least.
Yeah, I definitely agree with Nir. I feel like lots of people here have like they value their own space, and I've come to value mine as well and prioritize my own space, my own time, and things like that. I think one thing I do respect is how like medical students as well, they have a life outside medicine, so it's not just studying all the time. They dance, they I don't know, I have a friend who does kendo, so lots of different like sports that um students do here, and they make sure that medicine's not the only thing that's going on. They do have a like hobbies or things outside that, which I find quite interesting, and I also like push myself to like explore a bit more. And I think one thing that I noticed is that people here love the outdoors, so they love going on like walks, love going on hikes, and I started to appreciate that a bit more because you could not catch me outside in Malaysia on the grass sunbathing. But like now that summer and like spring is here, I do find myself on the grass a bit more, just like taking up the sun, taking a break, taking a breather, and I feel like that's a thing that I wouldn't have expected myself doing before coming here, but have definitely like appreciated much more since coming. Yeah.
I agree with Ishani, honestly. There's a big running culture here in Australia. So if you go
Yes.
at 5 a.m., you'll see someone running. If you go at like 2 in the morning, you'll see someone running. There's always someone running on every street. So
Yeah.
that was a big thing. Fitness is a big thing in Australia, and I'm pretty sure the UK as well. So everyone is just fit, either in the gym, running, going on walks. The outdoors is a very big thing.
So when you see like there's a bunch of people doing extracurriculars, like for example running or even your friend who does kendo, do you guys find like it's more encouraging for you to find things to do outside of medicine? And are you able to manage like if you guys do anything outside of medicine? Do you guys find it easier to manage than you otherwise would have like if you were in Malaysia, or does it have like what challenges would you face if you were trying to do such thing?
I think the main thing is it getting you to do it in the first place and it encouraging you to do it, which for me was a big thing. So when I first came in, one of the best ways I found in sort of relieving stress and sort of getting out is just going for a run, and seeing people going for a run pushed me to go for a run as well. And I consistently did it for around 6 or 7 months. It's just filtering your daily life around it. It's sort of you get started and then you'll filter the rest of your day around that schedule. Like you may start waking up earlier so you can go for a run. Or if you like running in the evening, which I preferred, you will come home. You won't wind down or sleep in the afternoon. You'll either eat, you'll do some work, and then you'll go for a run, come back. You'll study a little bit more, and then you'll sleep earlier. So it genuinely depends on you getting started. I feel that's the main thing for me. It's just you getting started and then figuring out the rest of your day.
I think individual hobbies like running definitely much easier to like schedule in your own time. But if you're looking to join a club or like societies, it gets way more challenging. For example, when I first came, I tried the softball club for like baseball club for 2 months, but it's quite difficult because clubs here they do their activities maybe on a Wednesday afternoon or Wednesday morning, which is when you are in placement. But for like non-medical students, they have that time off to do like sports activities and things like that. So I think finding that balance is also very important. Most of the time, you're very much restricted by placement and classes. So it can be a bit challenging, but on the bright side, there are like medic clubs that we have here as well. So there's lots of medic sports clubs like rugby, badminton, and things like that. So it's a bit more easier if you go to the medic sports clubs or societies because you guys have similar timetabling and it's much easier to join activities. And yeah, seeing people like do lots of activities definitely motivated me as well. I joined a dance performance or like a dance show this year that was organized by the medics, medic society here. So it was to raise funds for charity. So that just shows like lots of different things that medics here do that is not just purely academics.
Yeah.
Yeah, and another caveat that I should mention, I should add, is that in Australia, especially Western Sydney University, we have multiple campuses. So it's a bit logistically difficult to travel to a different campus to go for a specific club on specific days. So you have to have your own car, and even then you have to sort of balance the rest of your day in terms of commuting. Like in distances in Australia is actually another culture shock, I would say. It's very far, surprisingly far, and surprisingly big. Sydney is very big. You can drive for like 3 hours from one end to the other. So it's pretty huge, and a lot of people underestimate the distance, and that sort of limits you in terms of going out or even going for a club at a different campus, which might be like an hour's drive or a 40-minute drive away. But then there's definitely local clubs, which is easier to join, and you get to meet people in the community. But it just depends on how willing you are to just interact with other people as well.
So would you guys say overall it's been a smooth ride adjusting to living independently, or I mean, of course, for you, Nirhheshan, you said you come from Sri Lanka first, so you've got some experience being independent, right? But maybe you could tell us even, was it harder being independent in Malaysia or outside?
I mean, if I'm being honest, in Malaysia, like I mentioned earlier, there's Grab. Grab will make everything easier.
Yeah.
Cost-wise, it's cheaper, food's cheaper,
Yeah.
and in terms of like things to do, everything is closer distance-wise. So it's easier to go out with friends and plan and coordinate something. But then here, it was a bit more challenging because especially with the increased costs, you have to be more independent in terms of you have to cook more, you have to look after yourself more, plan your day out more. It encourages you to be much more independent than pre-clinicals because you have the clinical aspect of it as well. Like most of your day, it's pretty much like working in a way, preparing you to work a job because your mornings are pretty much taken by rotations, and it's just what you do with the rest of your day.
Yeah.
So it definitely is also a step up from Malaysia. And it's a bit of a shock at the start, but after some getting used to, you actually, it becomes a part of your natural like system, and you just get used to it. And like I said, with most of these things, it's just getting it happen and sort of accepting it and getting used to it. The faster you accept it, I feel the better you adjust to it, and the better you sort of, more likely you are to thrive in it.
I think for me, it wasn't as difficult to settle in because when I was living in Malaysia, I had already moved out from home. So whatever I was doing back in Malaysia is the same to what I was doing here. So I was already like cooking loads in Malaysia. I was already like doing my own laundry and things like that. So in terms of like household things, not too much of a shift. For me, I think mainly it was the placement side of things that I needed the most time adapting to. But I think what was very comforting was like the medical school was very, very open and very comforting to us. Like I remember going on the first day and I was just really scared of going into placement, but like loads of like doctors and the like lecturers and everyone was saying like, oh, you guys are like, you're all in this together. It's okay to make mistakes. You all are all welcome here. And they always emphasize that you are welcome on placement and you are part of the team on placement. And it just got me thinking that, oh, actually, I'm not the only one here who's feeling this way. Like, all of us are scared as well. And, like, all of us are, like, unsure of how things are going to move forward. So I think realizing that definitely helped me cope with the idea of, like, going to placements and, like, going into a new environment much better. But, yeah.
So my first question is in terms of career opportunities. So after you graduate, what happens? So my question would be, how difficult is it to stay and work after graduation? So do you guys have plans of coming back to Malaysia or your home countries, or are y'all planning to settle down there?
Okay, I think I'll start first. So for us here, if you graduate from your UK university, you are automatically graduating as a UK graduate. So you are you're able to directly enter the pool to start house officer or like foundation year training, which is like the training that you do to kind of certify yourself as a doctor. So here you have to do FY1, which is foundation year 1, to officially be a doctor, and then you do foundation year 2, and then you do start applying for specialty training. So for me, I will definitely try to stay on here and try to complete specialty training here. Getting FY is possible. Is not. I mean, you can definitely get FY training here. It's just depending on where you get it. So there is no fixed grades or fixed CV that kind of yeah, there is no fixed application form or like ranking on where you just are thrown randomly anywhere. So you could be placed anywhere in UK. You get to apply and rank your options, but again, there's nothing that guarantees you where you go. So it's very much a blind application process, and I guess that's one thing you kind of have to prepare yourself for. But yeah, in terms of specialty training, I think it's definitely getting much more challenging here, very much competitive, and that's where things like research or events, conferences, all those things come into play. Depending on what specialty training program you apply for, they have a different point system that they use. So, for example, you might need at least you might need to hold a teaching program for at least 3 months, 5 sessions. So those are like different kinds of things that are in the application process, and depending on what specialty you're interested in, you should kind of have a quick look and see what is needed of you. You can definitely do these things at med school, and you can definitely do them when you're training as a foundation year doctor as well. But yeah, it's definitely getting much more difficult and competitive. So the more you have on your CV when you're applying for specialty program is definitely more beneficial for you. There are programs which don't have a fixed list of components that you need or a grade system, but they go in terms of an exam instead. I have forgotten the name of the exam. It's either MSRA or no, I think it's MSRA, but it's an exam that you do, and based on the exam, they rank you, and then you go for an interview. So depending on your specialty, you might fall into one of these categories. But yeah.
Yeah, and just like Ishani mentioned, it's pretty much similar in Australia. How it works here is, I mean, once you graduate, you go into your sort of internship, as you say, which is basically a PGY1, which is your first year as a doctor, and then you do your first 2 years pretty much, and after which you can apply into the Australian training program. So there's three. There's the basic physician training program, there's a surgical training program, and there's a GP program. I think there's a separate pathway for anesthesiologists as well, not too sure. But then you apply for the program, and it is quite competitive to get into all three programs. Honestly, until last year, GP program wasn't as competitive, but it now has caught up. GP program is quite competitive as well. And like Ishani mentioned, you have to attend conferences. You have to have a lot of a sort of a point system, and you need to get a lot of things ticked off. And another thing that a lot of people here do to get more competitive is do an additional degree on top. So I met one of my registrars during my time in urology who mentioned that he did an additional degree in the Bachelor's of Surgical Science. And he actually mentioned that none of the things he actually studied applied to surgery, but it does definitely make it much more easier to compete in terms with other people in getting in. It is very competitive. And I myself plan on staying here, and I plan to do my BPT to be going to more sort of physician-based training rather than surgical training. But I have heard a lot of stories about how surgical training can be very competitive.
So do you guys feel like the degree you guys get from your respective universities opens more doors for you guys internationally?
Yes, I think it does. Yes, I think it does. I'm not really sure how many countries recognizes the UK degree, but definitely lots more opportunities. You can definitely work in more places. I think for Malaysia, one example for me is lots of friends here are Singaporean. So I think going back to Singapore is still an option, or staying here is still an option. But whereas in Malaysia, I think not many degrees were kind of recognized globally. So you would have to do extra exams before thinking of coming to work here. So I think definitely much more recognition. Yeah.
I'm not too sure as well, but I do assume that the AMC is pretty recognized. But I'm not sure to the level of the UK, because as far as I remember, a few of my Singapore friends told me that even if you graduated from Australian university, it wouldn't count in the Singaporean Medical Council. So I'm not too sure of the specifics in terms of countries involved, but I do assume that the AMC is it does open a few doors for you internationally.
Well, thank you guys. I think that's all the questions we have for today. We really appreciate you guys' time and coming and helping us. This will help also a lot of other med students who are planning to take the PMS be more considerate, take more things into consideration before they travel. And yeah, just thank you guys so much for taking the time out of your busy days.
Thank you.
Thank you.
All right, have a good day, guys. Take care.
Thank you. Take
You
care.
as well. Bye bye.
What's the battery?
It's gone.
It's gone?
Oh,
It just plummeted suddenly.
okay.
Gosh.
Let's hope it's saved.
Were
I
you
click
signaling towards
stop
me? I
here.
couldn't even tell. I was just like, I think
So.
I click stop here, yeah?
yeah.